Imagine a classroom full of children, their laughter and chatter suddenly silenced by a looming threat. This is the reality for over 150 students in South Carolina, forced into quarantine after being exposed to measles. But here's the shocking part. Every single one of these students was unvaccinated. State health officials have confirmed that at least 153 students from 2 schools in Spartanburg County, Global Academy of South Carolina and Fairforest Elementary, are now under a 21-day quarantine. This drastic measure comes as the state grapples with a growing measles outbreak, with at least 8 cases linked to this exposure and a total of 11 cases reported statewide this year. And this is just the tip of the iceberg. The US is facing its worst measles outbreak in decades, with the Centers for Disease Control and Prevention, CDC, reporting over 1,563 cases this year alone, the highest number since 1992. To put that in perspective, there have been 44 measles outbreaks this year, compared to just 16 last year. But here's where it gets controversial. This surge coincides with a troubling decline in MMR, measles, mumps, and rubella vaccination rates. Vaccination rates nationwide. Before the pandemic, over 95% of kindergartners were vaccinated with the MMR shot. Fast forward to the most recent school year, and that number has dropped to 92.5%. While that might seem like a small decrease, it translates to an estimated 286,000 kindergartners left unprotected against measles. And this is the part most people miss. Even a slight dip in vaccination rates can have devastating consequences, as it weakens herd immunity and leaves vulnerable populations at risk. So what's driving this decline? Some point to vaccine hesitancy, fueled by misinformation, while others argue that access to vaccines remains a barrier for certain communities. Is this a failure of public health messaging? Or are there deeper systemic issues at play? We'd love to hear your thoughts in the comments. One thing is clear. As measles cases continue to rise, the debate over vaccination is more critical and more contentious than ever.